Hi, my name is Casey, and today we'll be talking about careers in healthcare administration. Healthcare administrators are a vital part of the healthcare world and have some interesting roles that differ from typical direct patient care careers. Before we get started talking about healthcare administrators, I want to explain a couple of phrases that we might be using in this presentation. So, healthcare systems, to give you a quick frame of mind, when we reference healthcare systems, we're talking about a network of medical facilities and operations. Some local healthcare systems you might know are Samaritan Health, the Corvallis Clinic, Legacy Health. And what I mean by patient care or direct patient care are those trained professionals that are working in a hands-on capacity with patients and their families. So healthcare administrators lead and manage healthcare systems in settings like hospitals and hospital networks. They work closely with other healthcare professions with patient care as a top priority. They can also build healthy communities through program organization with other dedicated professionals. After this lesson, I hope that we'll have learned a few key things as we consider our possible future careers. These are all things to consider in any field of study you're contemplating so you can find the right fit for you. First, you'll be able to identify at least 4 healthcare administration roles and their workplace settings. We'll be talking a lot about specific careers in healthcare, including titles, salaries, and workplace environments. Next, you'll understand some of the responsibilities, tasks, and requirements of healthcare administrators. My hope is that you'll have a better picture of what goes on behind the scenes of healthcare systems and see if there's a future for you in any of these roles. Finally, you'll discover some of the amazing resources available to you as high school students, future college students, and maybe members of the healthcare workforce. This includes education requirements for many of these careers. So, why pursue a career in health administration? Personally, I didn't know that health administration was something you could major in or even a possible career path until my 3rd year in college. And since then, I've learned that in healthcare, there's often a fit for everyone. So why pursue a career in health administration? There's a lot of reasons to choose a career in health administration. You may be drawn to the healthcare field, but don't desire a role in hands-on patient care. Or you may have strong managerial skills that can be utilized at a healthcare level. The experiences you're having now as you complete projects, work on teams, and are learning about your leadership style can all factor into roles as a health administrator. Some pursue health administration for a more regular work-life balance. For instance, many health administration roles offer high salary, benefits, no weekend or holiday work, and this differs from other patient care roles such as nursing. Health administrators also have a lot of opportunities for upward career growth. Let's get into it. What does a health administrator do? I've got 6 responsibilities that encompass a lot of the responsibilities of healthcare administrators. Of course, there are more, but we can talk about the main roles that they have. Healthcare administrators provide support to healthcare programs and facilities. The most essential part of a healthcare administrator's job is the smooth operation of a hospital, health system, or organization. Now, job duties differ from position to position, but they may include the implementation and coordination of medical and health services. This can happen in the capacity as a medical secretary or a nursing home director. This means that they coordinate the process of patient care. They make sure that the patient is being seen by the right people and that the services are being billed correctly and there's communication with insurance agencies. Healthcare administrators also have a deep understanding of healthcare policy and laws. This means that they also coordinate the education of these regulations to staff and they anticipate issues with violations of policies. They also attend and contribute to meetings with investors and governing boards. Many of these board members include members of healthcare communities. Healthcare administrators make sure they're working collaboratively in the best interest of patients and the healthcare system. In the same vein is the open communication between medical staff and heads of departments. Administrators are responsible for their department and work to resolve employee conflicts or patient care between departments. Another thing health administrators do is they work on quality improvement and financial effectiveness. Many administration positions evaluate systems within the facilities to try to make things run better and more affordably. Healthcare administrators are also actively involved with staff scheduling, hiring, salary issues, and patient fees and billings. They can fill these duties in roles like human resource departments and billing specialists. I'll be using the word setting. So a work setting is the place where someone works or the environment, what it feels like to work there. The work settings of health administrators vary. Some work in giant healthcare systems overseeing several facilities at once. Other administrators manage a small group of medical practices, a particular department in a hospital system, or a single medical practice. Hospitals, medical laboratories, and physician offices serve as common work settings for healthcare administrators. Many healthcare administrators work in long-term care. What is long-term care? Long-term care are also known as nursing and assisted living facilities or rehabilitation centers. Healthcare administrators could also work in a single medical office with between 1 and 3 physicians and a small coordinating staff. Others work as consultants for large systems and might travel. Many administrators actually work from home, coordinating virtually with their teams. Your desired work environment could be a big factor in deciding your career path. The work settings of healthcare administration is definitely something to consider. Where do you want to work? It's time for a pop quiz. All of this information are things that we've already covered. So let's remember, what do health administrators do and where do they work? So, healthcare administrators do not A, understand health policies and laws, B, attend meetings with governing boards, C, help solve issues between staff members, D, treat patients in a medical capacity, E, coordinate medical and health services. If you guessed D, you're right. Healthcare administrators do not treat patients in a medical capacity. They don't have the education, licenses, or certificates needed to diagnose or treat patients. Nice work. Now, we're going to look into 4 healthcare administration careers that require different levels of education, certificates, and experience. We'll categorize these into entry-level careers, mid-level careers, manager-level careers, and top-level careers. For all these roles, we can think about what interpersonal skills are needed, the required levels of education, and you can think, is this career going to be fulfilling for me? Let's get into it. The first position we'll discuss is an entry-level healthcare administration position. Entry-level usually means that you can step into the role without having a lot of formal training. Medical administrative assistants are also known as medical secretaries. They perform secretarial duties for a medical office or healthcare facility, such as a doctor's office, hospital, urgent care center, or private practice. Medical administrative assistants are often the first person a patient interacts with at their visit. Now, day to day, their tasks might look like scheduling and confirming patient appointments, greeting patients, operating computer systems, billing patients, and processing payments and insurance claims. The most important soft skills, those are interpersonal skills, for a medical administrative assistant are professionalism, dependability, customer service, verbal communication, and problem solving. According to the Bureau of Labor Statistics, an administrative assistant or medical secretary can expect to make around $39,000 annually. Medical administrative assisting is an entry-level position and does not require a formal training program or certification higher than a high school diploma. There are associate level degrees and courses in insurance billing or medical computer systems that might help you secure a position. The second role we'll be discussing are healthcare human resource managers. These are mid-level healthcare administration professionals. Human resource managers are responsible for planning and coordinating administrative functions that specifically affect their employees. They recruit and interview staff, plan training for best practices. They work together between employees and the health system administrators. This role is employee-facing. Day-to-day, healthcare human resource managers hire and train new employees, plan and oversee employee benefit plans, mediate disputes between employees, meet with department heads to discuss staffing and training, and ensure compliance with state and federal laws. The most important soft skills for this career are leadership, organization, development, verbal communication, and decision making. This career requires at a minimum a bachelor's degree. That's typically a 4-year degree. Many of these administrators also have a master's degree in healthcare administration or human resources. Many managers in this position also have a lot of experience in the industry and specifically human resources. A healthcare human resource manager can expect to make, on average, around $111,000 annually. The next role we're going to be talking about is a manager level healthcare administrator. Nursing home administrators manage the business and organizational side of long-term facilities. When I say long-term facilities, again, I'm talking about nursing homes or assisted living homes or rehabilitation centers. Nursing home administrators pair leadership and financial skills within the medical industry. They're responsible for overseeing the medical staff and nurses and ensuring state-level updates and laws are being followed. The daily tasks of a nursing home administrator involve managing facility staff, designing budgets, managing billing and reimbursement, and again, reporting to the governing boards. They also oversee quality assurance protocols and coordinate between departments. The soft skills of a nursing home administrator are attention to detail, leadership, analytical skills, interpersonal communication, and technology. This career requires at a minimum a 4-year, usually bachelor's degree. Many of these administrators also have a master's degree and advanced certifications and licenses. Most nursing home administrators also need to be state licensed and need to have continuing education. That means that after they have their degrees and their licenses, they're required yearly or biannually to have continuing education. It's very important in the field of nursing home administration. Our final deep dive into the role of healthcare administrators are health information managers. These are top-level healthcare administrators. This is a very specialized role overseeing other health informatics specialists who are responsible for working with medical records and data. These managers work with data to protect and handle patient information. They ensure that the information is accurate, secure, and high quality. Daily, they implement information systems, work with staff to improve the quality of patient data, perform audits and comply with federal and state laws, and organize health information for better utilization processes. Now, the soft skills for health information managers are analytical skills, attention to detail, collaboration, leadership, and communication. The education requirements for health information managers are a bachelor's degree and extensive technical experience. This might be a good role to work up in. Many of these administrators also have master's degree and advanced certifications. On average, annually, a health information manager can expect to make around $151,000 annually. For the next part of our lesson, we're going to be talking about soft skills. In the roles that we just discussed, we talked about 5 soft skills for each role. Soft skills are character traits. They're things that could come naturally to you. They're strengths that you have that could be applied to jobs and projects and positions. Investopedia.com defines soft skills as character traits and interpersonal skills that support the pursuit of personal and organizational goals. For this activity, I'd like you to write down some of the strengths that you have. You can write down more than 5, and I'll give you some examples here. But I would like us to narrow them down to a top 3 or top 5 that you feel like you really excel at and that could be applied to future workplace positions or when you're looking and deciding what you want your major to be in school. So some of these examples are professionalism, work ethic, oral and written communication, teamwork, collaboration, critical thinking, problem solving, networking, enthusiasm, time management, adaptability, leadership, and dependability. These could be things that you've recognized as you've done sports or group projects, leadership assignments. Maybe it's how you connect socially with other people, or maybe you have work experience that you've noticed that things come naturally to you. I'll give you some time. Were you able to come up with some soft skills? It's great to have that list on hand when you're trying to make decisions, especially about your career. Next, now that we've talked about soft skills, I've got a pop quiz. Before we start this pop quiz, I want us to remember that list of soft skills that we made in our head. And I want us to pick out from this list which of these is a soft skill. A, programming. B, enthusiasm. C, content creation. D, editing. Or E, auditing. Which of these is a soft skill? Did you guess B? Enthusiasm is the only soft skill on this list. It might be a little confusing because some of these other things might come naturally to you. You might see them as strengths. The other things on this list are called hard skills. Hard skills are more technical skills that are also very useful when you're trying to pursue a career or choose an education path. Some other hard skills might be coding or bookkeeping. These are skills that are more specific. It's great to have a list of these on hand too. Soft skills are more transferable to different careers and different industries. Now that we've learned about what healthcare administrators do, where they work, specific roles in healthcare administration, and soft skills, it's time to think about the next steps for you, which are usually education and experiences. The U.S. Department of Labor reports that a bachelor degree is usually an entry-level education requirement for those aspiring to work as a manager in the health services field. A master's of healthcare administration is often a more common education path for those who wish to reach upper management. The roles we talked about in those upper management positions are human resource managers, nursing home administrators, and health information managers. Most employers prefer to hire someone who has a strong background of experience in administration in a healthcare setting, or those with specialized experience in one particular area of healthcare. A Bachelor of Healthcare Administration, or a BHA, and Master of Healthcare Administration, an MHA, are the most common levels of education in this field. Many healthcare administration roles require skills in business, management, leadership, and communication, and it might require an advanced degree as well as extensive experience in the role. In addition, most bachelor's and master's degree programs have internship opportunities where you can be matched with a specialty that will expose you to many parts of the healthcare industry. The U.S. Department of Labor also reports that in the decade leading up to 2028, these jobs in healthcare administration are expected to grow by 18%, which is faster than average. It's important to remember that while a career in healthcare administration will keep you involved in the healthcare industry, many of the skills and responsibilities needed for a successful career in health administration will differ from the ones in direct patient hands-on healthcare. These are some examples of questions you can ask yourselves to identify work environments and interests that might align with future career paths. So some of these questions, as you decide on how to plan your healthcare administration career path, are your own healthcare interests, your skills and strengths, your weaknesses, personality traits, your ultimate career goals, and your ideal workplace environments. So this is an activity we can do to answer some of these questions, and it might help us decide different roles in healthcare. So these questions are, do you enjoy working with others? The answer to this for our activity would be yes. Would you prefer a quiet work environment? Our answer is going to be yes. So if you're going to answer yes to some of these questions in healthcare administration, we might consider careers in nursing home management or psychiatric rehabilitation. These are just some examples of questions we can ask ourselves to help us narrow down our career search. Here's another set of questions that might help us decide on a career path. Do you want to work in a high volume setting? Our answer is yes. Would you prefer a lively work environment? Our answer is also yes. For these answers to these questions, we could consider careers in hospital management or laboratory management. With these two sets of questions that gave us a little bit more of a lead on career choices, did one of these speak more to you? Would the answers change if you consider the education or experience you might gain in each field? Each of these roles has a different set of education requirements or experiences that you might gain. All these things are things that we could factor when we're trying to decide what to do. Many of the skills and traits that will be useful to a future career are the ones that you're already developing now. If you would like to pursue a career in health administration, there are some things you can do, like working on communication and interpersonal skills through group projects and speaking and communication classes. You could also expose yourself to health science subjects like biology, chemistry, and physics. The other professionals that you would be working with are masters in these subjects, and it's great to have a common ground and a background in those subjects. Some of the extracurricular activities, volunteer opportunities, and school clubs can help you gain experience in leadership, delegation, and time management. You can also look for opportunities to job shadow with healthcare administrators, or you could check out programs at your desired colleges. All of this can be found online. Healthcare administration has a lot to offer, and there are many resources to help you along the way. Your teachers and counselors are here to help you as you think about the future and a possibility of working in healthcare administration.